So hello everyone. Welcome to Practitioner Spotlight. I'm going to be talking with one of our top level 3 master practitioners today, Dillon Walker. So welcome, Dillon.
Thank you. Glad to be here.
All good, man. So yeah, what we're doing with these Practitioner Spotlights is basically featuring our top level mastermind practitioners, the guys who've been through the level 1, the level 2, homeostasis quite recently, obviously in this case, and all of the mastermind modules, and just trying to get your perspective on how you use all this information, or maybe how you advise other people thinking about getting into it, and just to get some background on what you've kind of achieved with the information so far. So why don't you just tell us a bit about yourself? We'll go from there.
Yeah, Dillon Walker, College Station, Texas. Just briefly, by day, I'm actually a research assistant professor at Texas A&M, where we do nutrition and metabolism work. I've always wanted to get into an area or a business, in this case, where I can help others, especially those that are getting older. The old saying that, we should slow down as we get older, I really dislike that saying. And I feel like it leads us into a path of decrepitude, essentially. And so I've wanted to look for certain approaches that would allow me to challenge that dogma. And AMN has, really propelled me in that direction. And being able to say, no, you should be able to do that even though you're 80 years old, for example. In fact, I do have an 81-year-old client, and she's a go-getter.
Amazing stuff. So you run this.
Yes, it is.
You have your own company. I'm assuming that you're doing
Yes.
training with clients. So why don't you tell us a bit about that?
Yeah. Biosystem Fitness is the name. I run this in the mornings and in the evenings, and it evolved around fitness training. And from there, I wanted to be able to, so obviously with fitness training, things happen. Injuries occur, pain happens. And I wanted to be able to fix on the go, if you will. Be able to subject them to challenging fitness training, but also manage problems that arise in a timely manner. Because nothing hates it more than having to stop fitness training for 2 or 3 months to get over an injury, and then have to work their way back to where they were.
Absolutely.
So this, using AMN's approaches, has allowed me to expedite any problems that arise. And so Biosystem Fitness is founded around the emphasis of trying to improve the quality of life of anybody of any age, with fitness training, being able to recover from pain and injuries in a timely manner, but then also nutrition. Nutrition is one of our bigger things also, that we try to push, because we're not eating right. We've got problems, and I'm trying to educate people on how to eat better. So that's essentially encompasses the business and what I'm trying to do.
That's very cool. So you're essentially a research scientist by day, by midday,
Yep.
and you're helping people out in a practical sense, training them, improving their health, getting them out of pain, and giving them advice on, I guess, whatever comes up relative to their physiology based on the screening processes that we use. That's awesome stuff. I'm also pretty interested in now that I'm rapidly getting towards 40, I'm also interested in the kind of anti-aging perspective that there is on health. So I'm sure we could probably have some lengthy discussions on that topic to do with mitochondria and environment and nutrition, and I guess we'll maybe do that another time. But with regards to, that's a fascinating background first of all, but with regard to these sort of clients that you work with, is there any particular case studies, any particular people that stand out in your mind that you feel you've made some big change in, and you want to talk about how you've done that?
Yeah, absolutely. I have several. Essentially, initially it was just clients that were coming in for fitness training and then developing an issue. But now I've started to get, which was what my hope was, is to get more clients in that are actually just have pain complaints or trying to get over an injury. And so I'm starting to get more of those. I have a young lady that's come in. She came in with plantar fasciitis and had been to very many different therapists and was unable to get any kind of resolve. She had actually made progress, but it was still to the point where it was hard for her to run. And she's a runner. She wants to run. And that's all she told me is that I want to run. I want to run. I want this to be gone. I want to run. And over the course of a few months, we were able to get it resolved. And she's back to running half marathons and more. She's got more scheduled up. That was kind of one of the first bigger cases. I know you and I communicated quite a bit. I was getting lots of input from you on that one. That was kind of the first.
Go over some of those details. What were the sort of things that you found were coming up and that you found to be effective in that particular case?
Yeah. So it was essentially two things that I found quite effective was the emotional motor system screen, and then the neuromechanics.
Okay.
Those seem to play a bigger role. Now, prior to that, I had done everything that I knew how to do in terms of reducing tension. So everything that you guys have taught us, I'd gotten done. This predates homeostasis.
Right. Okay.
And so I did all of that, and then when EMS and neuromechanics came out, I went directly to that, and those made a huge impact. Now, in the past month or so, she'll come back to me every once in a while and say, I was a little achy this morning in that arch of the foot, and so I would bring her in, and it would actually be a limbic screen that would show up on that one after swiping the arch, go into a limbic screen, and it clears.
That's a very common kind of finding, man. I think, man. There's something that's underestimated a lot of the time by most practitioners and people. I think what I'll do is just briefly bring anyone listening up to speed on what it is we're talking about. So anyone who doesn't know, the EMS screen is something based around the work of a guy called Gert Hostage, who is a neuroscientist, I believe, who basically discovered what's called the emotional motor system. And it's something that basically modulates and governs the autonomic nervous system. And I developed a way to screen that sucker and see how it was affecting, usually in a negative sense, whether it was recruiting appropriately the pelvic floor muscles or the pelvic organ stimulating centers, and educating people on the connection between the pelvic floor and the feet, and how to reflexively fire the muscles relative to the pelvic floor, the TVA, etc. So that's what the emotional motor system goes into. It's not actually so much the limbic connection per se, is it? That's not really the link. The neuromechanic stuff is basically it's mobilization of the neural tissue. So it's a real structural apparatus of the nervous system, and we look at how to mobilize nerves. And I worked out that all of the peripheral nerves in the body are coupled, so you can do things cross limbs, and it's kind of a lot to do with our gait patterns and everything. And then so that's what you found to be effective in that case of plantar fasciitis. And then you've mentioned that when she comes back, there's a limbic issue. If there's tension in the feet, and what that's indicating is that she's probably had a long-term injury, that she has a definitive emotional, relationship with. And even if the injury goes away and then maybe the tension creeps back in, then she's got a psychological, emotional disturbance that she might not be able to run or something, or whatever the context of it is. And when you eradicate the charge of that, which is what we talk about doing, I'm assuming that the tension in the body also kind of turns down a little bit in conjunction with other stretches and mobilizations.
Yep.
That's pretty much it.
So,
okay.
Yeah,
Amazing,
yep,
amazing
it does.
Stuff.
It works. I mean, it's doing well, and she's happy. She seems to be happy, and she can run.
Yeah, that's amazing stuff, man. Is there anyone else you want to tell people about that you've worked with?
Yeah. So, there's a few more. I've got a young lady that some time ago, I believe it was a couple of years ago, her ankle collapsed on her and had to get her ankle fused. And well, she has been dealing with chronic pain, extreme chronic pain. And now, I mean, she has an ankle that just does not move, doesn't plantar flex, doesn't dorsiflex.
Wow.
It's fixed. And since she's been coming here, we've been able to reduce pain. And so this is actually after homeostasis come out. So I'm just constantly, every time she would come in, going through each each screen of the homeostasis. And then also, one of the other things I thought was really beneficial is I got her on a grounding pad. Almost immediately. I'm like, you need to get one of these. If you don't like it, I'll buy it back from you. But get on one of these grounding pads. I mean, live on this thing. And that, in addition to coming in, and now she's doing some fitness training. The pain is reduced down to the point where we're learning how to move with a fixed ankle joint. One of her biggest problems is stairs, especially going downstairs. So we're learning how she can effectively go downstairs, and she's doing all this pain-free.
That's amazing.
Essentially pain-free.
Yeah.
And then another case, I've got a younger gentleman, actually close to my age, has cerebral palsy. Extreme pain. He's had some joints replaced. Extreme pain, almost to the point where he was looking at getting a wheelchair. And the feedback that I'm getting from his mother the past couple of days is like the past week he's been a different person, meaning he's able to get up and move around without pain. They're on grounding pads. I got him on them immediately. They're sleeping. And it's wonderful news to me to hear that is actually helping improve his condition.
Absolutely. I mean, that's a wonderful thing to experience as a practitioner. Amazing for the individual, but it's one of the most rewarding things that you can experience in this kind of role, isn't it? When you get those kind of changes in people, that's incredible. And with this guy, with the gentleman with cerebral palsy, you mentioned he's sleeping better. Did you use any of the sleep protocols with him or anything like that? What sort of stuff have you done with him?
I went through the sleep protocol, and his body clock was off. And that was it. That's all I found in terms of the sleep protocol.
Okay.
The other things that I've done was the homunculus scan.
Okay.
That one was huge.
Okay.
That was huge.
So that's the Mastermind Module 1 stuff.
Yep.
And locating specific areas of charge instead of gross kind of screens. And that showed up a lot with him.
Oh, yes. And actually what I did is I didn't go to that first. I just started going locally. So, for example, he's had a hip replacement that actually was a faulty hip replacement. And so he had to have it redone. And so he's got a lot of pain in that right hip. And so I went locally. I started locally, and it wasn't really working. And I'm like, wait a minute, I need to go scan the homunculus. As soon as I did that, reduced the tension, went back to the hip, it worked.
Amazing.
I mean, almost immediately reduced pain. Now, he's come back a few times after that, and I've had to go back and just, the tension kind of creeps back. I reduce it, and it's actually starting to stick more and more now. But that was the key with him, was the homunculus scan.
That's very, very, very cool, man. So just to bring people up to speed with what we're talking about, if anyone doesn't know, in AMN we talk about scanning for tension, which is essentially what we're doing is we're scanning for what we're perceiving as increased electrical charge in the system. And then when, as a practitioner, assuming that your charge is lower than that of the client, when you touch the client, if there is an area of increased tension, there's something called basically charge will dissipate through the practitioner, and that the charge will drop towards the point of lower potential. So essentially there's a charge transfer occurring between practitioner and client, and that's that we get an indication of that through a muscle test. So we just use a muscle test as feedback essentially. And then when you find all these combinations of increased tension or increased charge, and we calibrate them, which is as easy to do as tapping and standing someone on an earthing pad, you can see changes in function. You can see dramatic changes in function. So that's essentially, if anyone listening doesn't know what we're talking about, that's essentially pretty much what we do. And then that is all correlated with, training, complex movement, lifestyle recommendations, etc., such as the things that you mentioned being involved in your research and everything through nutrition. So there's some amazing cases. They're very, very cool. How do you tend to approach nutrition with people then? Have you tried using, for example, when I am working with clients, I'm very interested in the gastrointestinal system, as you might have gathered from homeostasis. And I find now that I'm able to screen people and find where there's asymmetry in their microbiome and find where there's asymmetry in their digestive processes, and recommend actually taking things away as opposed to putting things in a lot of the time as a kind of a baseline. And we're using fasting a lot. I'm using lifestyle recommendations where, for example, we've mentioned earthing pads. That's a whole topic. We could talk about that all day. But I have lifestyle recommendations where I get the people to sometime between 8 and 11 in the morning, to be outside, shoes off and feet in contact with the ground, ideally facing towards the sun, so that they're getting the appropriate photon emission, the radiation from the sun. They're getting the contact with the ground, that negative free source of electrons from the ground. And I combine that with saying, well, from the assessments, it would appear that you have maybe high histamine levels. So I would avoid mackerel, sardines, tuna. I'd avoid these kind of foods. It would appear that the IC valve is maybe not functioning appropriately. This is a valve between the large intestine and the small intestine. And with that in mind, it might be worthwhile you trying some fasting in amongst all this other stuff that we've talked about. And I find that we get some pretty good resolution from that, because we have the combination of showing the system where it has increased charge and the nervous system's kind of kicked into gear to take a look at it, I think. And then we make the recommendations around lifestyle. And when those things go together, I'm finding that we get some pretty good change. So how do you approach the nutritional side of things with your clients?
So when I start them off, even before I start screening for whatever issues they may have, I actually start off, I'm a firm believer in low carb. I feel like that has a significant influence on the gut microflora in and of itself. And certainly I don't, my comments on nutrition are only recommendations to clients. I can't make them eat a certain way, but I try to educate them on the fact that carbohydrate consumption can have a significant impact on all systems in the body, including the gut. And even when I'm screening clients for whatever issues, actually GI does not come up very much. I can only think of a handful of times I've had it come up on clients. And so it is my belief, based on the research that I've looked at, that actually carbohydrate consumption will improve the microbiome. With those that do have issues already, for example, I have a client that has completely removed large bowel. And so I recommended that a probiotic might be a good bet to go with, even though nothing has really shown up. Now she's complained about GI distress for a long time, and she hasn't been on she's been on a kind of a typical American diet, lots of everything kind of stuff, and so I've recommended low carb and then a probiotic. Those are kind of the go-to suggestions that I make, because in my experience that kind of clears up a lot of things, especially when it relates to a chronic condition or inflammatory condition. So those are kind of the recommendations I make, and then if I do find something in a screen, GI screen, then I make further recommendations based on what you've taught us. Yeah. But again, that really, in my experience, that doesn't come up that much. The GI, I mean, hardly at all.
Do you find there's many immune findings with people that you've been working with?
There's a few more immune findings, but 98% of the time, and I truly mean 98% of the time, it's limbic.
Okay.
I mean, just straight limbic. I'll go through all screens all the time and nothing shows up, and it's just limbic.
That's interesting.
Occasionally, I will say, other than limbic, I will have osmolarity show up. Is my next highest. That's another thing I tend to find, is that low dehydration. I mean, not extreme dehydration, but moderate dehydration, and then lack of sodium. as the two big ones. I've actually helped a couple of clients with headaches. They have chronic headaches, and just ensuring that they're consuming plenty of water and plenty of sodium, and that tends to resolve the headache issues.
Yeah, that's interesting. So again, just to bring people up to speed if they don't know, we're talking about the Limbic Screen is part of this level 3, this homeostasis course, and it's the very first screen that we recommend you do for that very reason, that it's so influential over every other system in the body. So we're talking about scanning for tension or for charge relative to memories about emotion or emotional memories. And that can be things that are relative to certain conflicts in somebody's life, be it completely subconscious to them, or be it acute, that have their acute awareness on it. There tends to be, if there is emotional distress in the system, then the physiological body is directly affected, and it can be affected in very direct patterns, as some of the reference material that we provide in the course kind of indicates. So limbic stuff, hugely impactful. Interestingly, I'm not the biggest fan of doing the limbic screen. So, maybe that has something to do with the fact that I don't find as much in it. But
Yep.
I know there's a few of you guys out there who really enjoy scanning the limbic stuff. Well, enjoy it, I don't know if that's the right word, but you definitely dive into it, like yourself and Scott Robinson and Gareth as well are very keen on checking out the limbic factors. But it's been great talking to you, man. How would people get in touch with you if they wanted to book a session with you, or if they wanted to come and talk to you about training or treatment?
Go to my website, www.biosystemfitness.com, or my Facebook page. They can email me. All my contact information is on my website and on my Facebook page. Absolutely.
Fantastic. Well, it's been an absolute pleasure speaking with you today. I think you're going to get a lot of interest from people in your area coming to see you to come and get some of this strange AMN tapping and complex movement stuff to help them out. So
they call it voodoo over my end.
I've been termed a voodoo witch doctor for many years, but I've gotten over it now. So
right.
Dillon, thanks so much for your time. I'm looking forward to seeing you when you come to London.
Absolutely.
And we shall speak soon.